Hi, everyone. Thanks so much for tuning in to the webinar. My name is Kate Quigley. I'm the Lead Resource Specialist and Project Manager with United Way of Connecticut 211, and I'm joined by my colleague, Annie Scully, who is a Research Analyst in our Community Results Center. Today, we're going to be sharing information with you about 211 services, and we're going to be going through a live demo of our public website to show you how to look up information and resources. So we appreciate you tuning in. So for those of you who may not be aware, 211 is Connecticut's free and confidential information and referral line. So we're available 24 hours a day, 7 days a week. We never close, so over the phone, someone can call us anytime, or our database is accessible anytime online. We have been in existence since 1976, and we began as InfoLine, as a public and private partnership between United Ways and the state of Connecticut. And then in 1999, we actually became the first state to use the 211 calling number statewide. So nationally, there are about 200 independently operated 211s throughout the United States, many of which are operated by United Ways. Our Connecticut 211 is accredited by AIRS, which is the Alliance of Information and Referral Services. So we're accredited as both an organization, but our staff in our contact center and in our resource department are also accredited individually. So we do help a wide range of people across Connecticut, be it individuals and families, parents, providers, social service organizations, legislators. So really we are available to help anyone in need with any particular question about how to locate valuable services in Connecticut. And so we do that by fielding calls through our contact center, and our contact specialists are highly trained. They will do assessments for the individual immediate needs that are being presented to them, and then make referrals accordingly. And then our database itself, so my department is a team of 5 in the Information Services Department. We maintain the database of about 4,000 agencies, which produces about 40,000 programs and services. So we are required to do a formal update with each organization represented in the database at least one time per year. But we're continually updating the system. It's a living, breathing database that is always being updated and changed based on programs coming up or losing funding and going away. So we're constantly updating the information. We are, as I mentioned a moment ago, accredited by AIRS, and part of that accreditation requires us to use a standardized taxonomy system. So we think about it like a Dewey Decimal System in a library. So it's really our categorization system of resources in the database. And we couldn't do what we do without the support from the local United Ways and the state of Connecticut. So just a quick glance here at some statistical information. We have fiscal year 2017 data. So we handled about 267,000, over 267,000 calls from residents, which we gave out about 306,000 referrals. And you can see on the left slide here the top 10 service requests. Housing and shelter are always pretty high on the list of statistics in terms of call volume. And then in the same fiscal year, you can see the amount of hits to our public website, over 1 million, which is really exciting for us. The number of hits to our website has grown significantly since we've made enhancements, so we're very proud of our online services. So I'm going to turn it over to Annie to discuss some of our specialized services.
Thanks, Kate. And as Kate said, we do operate a 24/7 call center, which has, individuals that are here to answer the phone 24 hours a day, 7 days a week, and a database maintained by 5 full-time resource specialists. But in addition to that contact center, United Way offers a number of specialized services. We have our 211 child care line, which helps families find child care programs that meet their needs. And as you'll see, there's information on how to dial into that service as well as access it online. We operate the state's child care subsidy program for low-income working families, known as Care for Kids. We also have a child development info line, which connects parents to services for children with suspected or diagnosed developmental delays and serves as an intake for birth to 3 services. And this line can also be called by new parents, first-time parents that just have questions about if their child is growing and developing at an appropriate rate. We also are the central intake for our crisis intervention for youth, which is known as the Emergency Mobile Psychiatric Services. And that's also available 24/7, 7 days a week, 365 days a year. We have a 211 housing line, which is for coordinated access to housing and emergency shelter in Connecticut, and that's known as the CAN, Coordinated Access Network. We also have a 211 navigator, which screens for potential eligibility for 23 federal and state assistance programs, and Kate will give you guys a quick overview of that navigator in her website demonstration. And more recently, this has been sort of a busier component of our work, but we have a disaster response component. We take direction from the state partners, the Department of Emergency Management Services, as well as the Governor's Office to assist in disaster response. As I said, Kate is going to go into a live demo of our new website, but some of the new features that we're most proud of are translation, which is powered by Google. Our site is completely location aware as well as mobile friendly. We have an events calendar. We have advanced search features, which include a search by keyword, program name, category, and need statement. We have the ability to filter search results. You can get directions via Google Maps, and you can also share and build a resource cart. Another component of this presentation, and something that we're super proud to talk about today, is our 211 counts. So in May of 2016, Connecticut became one of the first states to launch an online data dashboard known as 211 counts. And it's a tool that provides real, searchable, and visual presentations of our 211 contact center data across 13 categories and 76 subcategories. So as Kate went over in a slide earlier in the presentation, we field more than 200,000 calls each fiscal year and more than 300,000 requests for service. So that data really paints a great picture of the needs in our different communities across the states. And 211 counts is a great way that you can access that information. It can be used to establish trends and identify statewide and community-specific needs by zip code, region or municipality, state house or congressional district, and custom time frame. And 211 counts allows interested parties, stakeholders, and decision makers to analyze call data as recently as yesterday, study trends, make comparisons, conduct community needs assessments, and really share information with people within their communities or with people that are in positions to make decisions within our state. So without further ado, I'm going to do a quick live demo of this new online data dashboard. Give me 1 second. So by going to ct.211counts.org, you'll land on our 211 Counts homepage. And just to give you a quick overview of what this page presents and sort of the default settings that you'll arrive at when you come to this website, every time you visit 211counts.org, it'll automatically show data from the last 365 days. So for data as recent as yesterday and dating a year prior. It will also show information for the entire state. So while you can filter it by specific town or community or Senate or House district, when you arrive at the site, it shows for the entire state and for the last 365 days. I want to draw your attention to the upper right-hand corner very quickly, where you'll see a total call and total request count. As you'll see, the total calls count is always going to be smaller than our total request count because an individual call could have multiple service requests. So for example, each time you dial 211 and you're connected with a contact specialist, that's tracked as one call. However, someone calling from New Haven may be seeking food resources such as a food pantry and counseling services. And because those are two distinct needs, they qualify as two separate service requests. As we sort of scroll down the page, you'll see in the upper left-hand corner, these are our top 13 service requests. And they can be displayed as a percentage and as a count. So right now you're seeing that housing and shelter over the past 365 days accounted for just under 29% of all of our service requests. If we wanted to see that information as a count, we would click count, and we'll see that that almost 29% equates to about 90,000 service requests. If we scroll over to the right side of the screen, you'll see a separate bar chart which drills a little bit deeper into each one of those service categories. So for housing and shelter, it'll break it down by shelter, requests for shelter, low-cost housing, home repair and maintenance, rent assistance, and so on. And once again, within each of those categories, you can show the tally by count or by percentage. So right now, I'll go back to percentage. all the way over to the right, you'll see a category that says unmet. And what this does is show of those, 55% or as a count, 50,000 requests for shelter, we were able to meet 91% of those, which means 9% of those service requests were left unmet. And when a request is unmet, it means either there was no resource in the database that we could refer a client or an individual to, or that that individual did not qualify for that type of program or service that was available in our database, and less frequently because there was some sort of barrier, such as their work schedule or transportation, that didn't allow them to access that resource. So right now we're going to scroll a little bit farther down the page, and I'm going to direct your attention to these sparkline graphs on the right side of the page. So the top request, or the top chart, I should say, shows requests by time, so month by month, for this current year and the year prior. So this blue line right here shows month by month all of our requests for service from November of 2016 until October of 2017. And these two graphs really allow for some quick sort of assessment or analysis of trends throughout the year. So how did this year's service requests compare to last year's? So it's a real quick picture, a real quick snapshot of the different services that we tally each month and how they compared to the previous year month. A little bit farther down, you'll see the second spark line chart that shows requests specific to the category that we've selected. So right now, because we selected housing and shelter, the spark line shows the service request for housing and shelter. So we can see in May of 2016, there were 9,467 requests for housing and shelter. And in May of 2017, there were 7,606 requests for shelter. So once again, it allows for some quick analysis as far as trends. And you can see, interesting enough, that although there's a difference in the number, the tally of calls or service requests made, the lines sort of move in a similar fashion, which shows us that, the trends month to month have been somewhat consistent from year to year. Over to the right, there is a map which should be populated. I'm going to go ahead and refresh the page really quickly, which will show you another visual presentation of our 211 counts data. Just give me 1 second. And after we kind of go through this map, I'll show you a sample search and an example of how to filter by custom date range and by specific town or municipality or House or Senate district. So I'm going to go in and I'm going to zoom in just a little bit, maybe a little bit too far. And as you can see, this is the entire state of Connecticut. And this is also showing for housing and shelter requests because we selected that category. But if I was to go in and choose clothing and household, the map would repopulate to show clothing and household requests. As you can see, the darker shades, this is showing by zip code, represent higher concentrations of requests. For the lighter shade of green, it shows intermediate. For that sort of pale green, it's low requests. And then if it's that gray color, which is a few of these, that shows that there was no request made over the past 365 days for household and clothing service requests. If you wanted to share this information, there's information on the side of the page here where you can run a brief or a detailed report, and you can also share on social media platforms such as Facebook, Twitter, and Google. So all the way back at the top, as I said, the data on this dashboard is as recent as yesterday. Each evening we have a data transformation, and it's repopulated by 9 a.m. the following morning. So it shows data as recent as yesterday, which is something that's great to be able to capture. But you can also drill down or filter by various geographical regions, such as zip code, county, congressional district, state house, Senate district, and region, which in our case refers to a town or a city. So you can go ahead and you can type in a specific town. You can select all towns if you want to show, instead of zip code, you want to show the region by town, or you can select a handful of towns. Maybe if you're a local United Way, you're interested in your catchment area or your service area, and you want to go in and you want to select those individual towns. For the sake of this presentation, I'm going to select Hartford. Click search. I think I spelled it wrong, so we're going to go ahead and select Hartford there. And all of the data on our dashboard will repopulate to show information just specific to the city of Hartford. We can also go in and select a custom date range. So we can either choose to type in a specific date range, choose just requests that were made yesterday, show for the past week, the past month, 90 days, 180 days, or stick with our last year, so 365 days. And for the sake of this presentation, I'm going to go ahead and choose choose the last 30 days. So this will show all the service requests that have been made between October 3rd and November 1st. If we scroll down a little bit, you'll see that it now just shows on our map the city of Hartford, but maybe we want to see it by zip code. And in that situation, we can go ahead and we can click zip code, and it will repopulate to show the different zip codes that are contained in the city of Hartford. So we can see, for the most part, for clothing and household items requests, all of those zip codes have a high concentration of need. However, there's one exception, so sometimes it's important to be able to see that distinction. If we go back up to the top and we go ahead and we select housing, that map and all of the information, including the subcategories to the right and the information on this second spark line chart, will repopulate to show just housing and shelter. So once again, this is just a quick overview of our 211 counts data dashboard. If you guys have any additional questions or want a more in-depth presentation, please feel free to reach out to us at United Way of Connecticut, and we'd be happy to do sort of a deeper dive into what this tool can show you. We encourage you guys to use it. The best way to learn how to use it is to just go on the site and run some sample searches yourself. And at this point, I will go ahead and turn the mic back over to Kate, who's going to give you a live demo of our 211ct.org website. Thanks so much.
Thanks, Annie. So for those of you who have yet to use our website, I'm going to give you a walkthrough of the site from the homepage into a search and show you some of the more advanced features that we have now on the website. So as Annie said, our web address is www.211ct.org. This is our homepage. If we scroll down just a little bit on the homepage, I want to point out some of the specialized services that Annie spoke to earlier on. Our child care unit does have their own unique website, which can be clicked right here to access child care centers statewide. And our Child Development Info Line also has their own website, which can be utilized as needed to find information, but also anyone can make a referral into the program right from their website. Further down on the homepage, we're going to look for our 211 Navigator, which is at the bottom left. So the Navigator is an online benefits screener, which will assess eligibility for all of these state and federal programs. It is a free screener. No identifying information is required, meaning no social security numbers or birth dates. It's a simple screener that will assess by household demographic information, income details, and once you hit submit, it will let you know which programs you may or may not be eligible for. Let's say it deems you eligible for food stamps. You can click on food stamps. If you click on more information, it'll bring you to a page that explains the nature of the program and all the eligibility criteria. And in this case, you can also click for the application to apply for the food stamps program. Not all of these contain applications, but some of them certainly do. So again, that was our 211 Navigator located at the bottom of our homepage. And I'm also just going to show you quickly our categories. The categories will identify some links into the database based on topic or specific population. So if we chose substance abuse, you're going to see a few links here. This is not a full list of all the resources for substance abuse, but it's more a slice of the database really to get you started and get your foot in the door, so to speak, to start accessing information and resources. All right, I'm going to go back to the homepage one more time, and we're going to start in on a true search here. So we're going to use this empty search box, and in here you can type anything that you'd like, a phrase, a word. If you know a program name or an agency name, you can certainly put that in. For the sake of this particular demo, I'm going to just start typing in wellness, and you'll see that our taxonomy term wellness programs auto-suggests itself. So these are the terms that we have to adhere to based on our accreditation process. I'm going to choose wellness programs, and I'm going to click search. What it's done here is it's recognized my location. We are in our offices here in Rocky Hill, but if you don't want it to do that, you can clear this out. If you leave it blank, it defaults to Connecticut, so it's going to search resources for the whole state. but in this field, just know that you can type in a zip code, a city, a town, or even a location by address, and it will find resources as close as can be to that particular location. So I'm just going to click search. And we see for wellness programs serving the whole state, we have 104 resources. So that's a fair amount of options statewide. And all of these pins on the Google map over here translate to all of these records on the left. So let's say you wanted to use the map and you're looking by that view. If you click on one of the pins, it's actually going to drop it down to this resource at Bristol Hospital. If you were on your phone, you could do a quick call, view the website, or get directions, which are powered by Google, and it's walking, bus, train, driving, directions all included in that. I'm going to just scroll back up to the top. I also want to show you one of our features of translations. So at the top of the search page and the home page is a globe in the top right corner here. If you drop it down, you're going to see that you can choose any one of these languages and the site will fully translate into that language. I'm going to choose Japanese and just give it one moment. You'll see that the resources translate into the language that you have chosen. If we clicked on the details of this particular entry, it's going to translate all of those. And if we started at the home page and chose translation, it would have carried us over into this page here. So to get back to English, we go right up to the top and choose Show Original. And then I'm going to go back to Results and get the full list. Some of our filtering options that are available, if you click Show Advanced Filters, we do target certain resources by population or specific need or particular health concern. So as you see here, we have diabetes, heart disease, health issues, AIDS, HIV, and arthritis. Let's say you wanted to narrow this search down by wellness programs for individuals who may have diabetes. So we just click diabetes, click filter results, and you'll see that that initial list of over 100 now has dropped down to just 19. So a bit more manageable list statewide. And let's say you wanted to build up a resource cart so that you could keep track of these resources that you were looking at. So add to cart is the prompt here from every single one of these resource cards. So add to cart, I'm going to do a few. And you'll see at the bottom left, it starts to build up the number of resources in your cart. All right, so I'm going to stick with those 3, but I'm going to do another search because I want a few different options in my resource cart. So we've done wellness programs, and now we're going to look up smoking cessation programs. So again, if you start typing smoking, you're going to get this term pre-suggested for you. You can choose it, and then this time I'm going to narrow it down by a city. So we're going to put in New Haven. And Google will recognize what you're typing, and you can choose it, and then click search. So smoking cessation programs that serve people living in New Haven yields 11 resources. So let's say we want to know a little bit more about this particular program offered at Yale University School of Medicine. Click on the details. It's going to give you a full description, eligibility based on age or other criteria, who they serve, whether there's a fee or not, all the necessary contact information, hours of operation. And then if you scroll down farther, you're going to see the main agency information. So the Yale University School of Medicine full record. We last verified this on March 10th of 2017. And if you scroll all the way down and click See All Programs, you're going to see every resource that we have tagged under all of the various sites of the Yale University School of Medicine. All right, let's say this one record is a great fit for someone that you're working with. And they either want a printed copy of this or they want it electronically. So if you click print and share, you can print this one resource, you can send it by email, or with one record, you can send it by a text message. So you just plug in the cell phone number and then drop down to find their provider and click send, and it will arrive on their phone as a easily readable text message. So let's go back to our resource cart. We'll add this one to the cart as well. So now we have 4 resources. With the cart itself, you can print it or you can email it. Unfortunately, at this time, we can't text a full cart but know that email is absolutely a possibility for a resource cart, and you can add as many resources as you'd like to the cart. It is endless. Just be cautioned that it is single session use, so if I closed out of this web browser right now, the cart would go away. But what's coming soon is the ability for people to log in to our website and create custom lists of resources which can be saved. So please stay tuned for that, because that is coming down the pike shortly. So that will allow providers to be able to really do some potential mini case management, if you will, keeping track of resources that you're pulling together for constituents or clients or patients in a way that it will be saved to reference back in the future. All right, so I'm going to just go back to the last search one more time and draw your attention to suggested terms. If you click on any one of these, it will re-up the search and bring you to this particular resource. And then the other options here for filtering is you can filter whether a resource is open now or not, if it's open on a particular day of the week, filter by gender or age. Okay. Lastly, just to close up the demo here, we do have an e-library of about 450 papers on various topics that are broken down by category, which you can search at your leisure. You can also type in a keyword or a phrase to hopefully find what you're looking for within any of these 450 papers. And lastly, I'm going to just quickly show you our professionals page. And this is where you can access the 211 Counts website directly, the one that Annie just went over. So under Special Projects 211 Counts, that's a direct link that you can use. On the left here gives some guidance as to how people can update their records with us. So you can update right from the website. You can also add a new program or a service, and you can read our inclusion-exclusion criteria as well. And here is our community calendar, which is populated with events offered by agencies represented in our database that are free and open to the public. So we do have a lot of tools on our site. If you're looking for further training on our website for your staff or other groups that may be interested, you can certainly reach out and let us know, and we'd be happy to schedule that with you. I'm going to pass it back to Annie one more time.
Thanks, Kate. And just to close out our presentation, thanks again for your time today. And we're excited to share our website and our 211 Counts data dashboard with all of you. So in conclusion, we want to just remind you to refer your patients, your clients, and your constituents to 211. So without hesitation, if you're working with an individual that could benefit from talking to one of our call specialists or utilizing our website, please do so. If you're comfortable showing them how to demonstrate the website or how to go through the website, we definitely encourage that, but don't hesitate to reach out to us for further training. We also want you to use our 211 database to locate valuable resources. So if you need help navigating the website, or if you need additional services or instruction on how to run custom searches that are specific to your community, once again, don't hesitate to reach out to us. Also, don't forget to use 211 Counts to assess your community needs. There's a link for it right in this presentation. Click on that link and get familiar with the new data dashboard. You can also add and update program listings to the 211 database via our professionals page. So if you're an agency that's represented in our database and notice that your information is not up to date or doesn't include all of the programs and services that you're currently offering, please choose that update report option or contact our information services department. And finally, please share our 211 promotional video to raise awareness for 211. If you operate a doctor's office, or if you have a waiting room in your lobby, this is a great place you could play that video or make it available on a laptop or computer that you guys have. So in conclusion, the mission of United Way of Connecticut 211 is to help meet the needs of Connecticut and its residents by providing information, education, and connection to services. And we really depend on all of you, our state representatives, our local providers, to make sure that we're A, doing that, and B, representing all of the programs and services that you guys are offering throughout the state of Connecticut. If you have any questions or wish to contact us further, Kate's information as well as mine is presented on this slideshow. And we want to thank you once again for your time, and have a great day.
Thank you.